Run, river, run, run through the hills. Run, river, run to the sea. Run, river, run to your place beneath the sun. Run, river, run.
Hi, this is Jan Lewis. Welcome to be my guest today. We have Kathy Faddoul, who is an RN and a teacher, and she leads the health technology program at Assebet Valley Regional High School over in Marlborough, and it's the students learn by doing. And welcome, Kathy.
Thank you.
Now you're an RN and you teach. You're a health tech. You're a teacher over at Assebet Valley.
I am.
And you teach what subjects?
So it's a health assisting program that I teach. So our students learn a certified nursing assistant curriculum.
Yeah.
So when they learn many things, but one of the things they learn is how to be a nursing assistant.
Mm-hmm.
So they're eligible to sit for the Red Cross nursing assistant exam their junior year.
That's awesome. Now, what we're going to talk about today, I've read in the Community Advocate. Did you see this? Look at this. Now, tell us from the beginning, how did you get into this? Is for the students at the high school who are learning nursing, right? Boys and girls, right? Tell me about this.
So we ran a drive at the high school called Dolls for Dementia.
Dolls for Dementia.
So one of the things that we are really passionate about at Assebet is making sure that our students have all the tools they need when they graduate.
Yeah.
Many of them will go right into the work world, and many will go to school. But we want them to be prepared for whatever they come face to face with.
Right.
We do a lot with dementia. We teach our students how to work with people with dementia. We come across many people who are living with dementia in our studies when we go to Coleman House, which is where we go for our clinical placement.
Mm-hmm.
When we go to go out into the community, and people will come across people living with dementia in their hometown. So we do a big curriculum about dementia, teaching people about Alzheimer's disease and other types of dementia.
And people might be wondering out there, why is Jan sitting there with a doll?
So,
why?
The dolls bring comfort to people living with dementia. So
I like it.
I know, it's
mine.
nice, isn't it? So, for a lot of people who are living with dementia, they can't. They have a lot of anxiety.
You can't articulate what they're feeling.
They can't articulate what they're feeling, and they don't really know what's coming next. They can't plan ahead. It's part of the disease. So, one of the things that many people who have dementia find comforting is taking care of their baby.
Yeah.
So many people will think that the baby is real, and they are happy to hold the baby. They're happy to look at the baby and to give love to the baby. No, it's not for everybody.
Yeah.
Not everybody who has dementia enjoys holding baby dolls, but many people do, and they find that it helps to decrease their anxiety.
Was this your idea? Did you come up with this?
No, there's actually been research done on doll therapy. We just noticed that when we were out working with residents, that many of the people wanted babies. I had one resident who had 3 babies, and she was so happy to have all of her babies with her.
3 dolls. She sat there with her
Yeah,
dolls.
with her dolls.
Was she in a wheelchair?
She was in a wheelchair, and
Yeah.
she was just thrilled and happy, and would look at her dolls, and you could just feel the love.
Yeah.
But research has shown that dolls, when presented in the right way to the right people, can relieve anxiety and discomfort.
Oh, stuffed animals too,
Yeah.
right?
Yeah, some people really enjoy the stuffed animals.
Oh, yeah. Do the guys, now that's a boy doll.
Yeah.
It's a girl doll.
Yeah.
Do the guys, do the men?
Yeah.
They do.
Yes.
Do they must have grandchildren and it brings back memories or children?
So with Alzheimer's disease, that's the thing that people still have. They lose their short-term memory.
Yeah.
They lose many things, but one of them is remembering recent things. But they do remember things from long ago. So, and who doesn't like to just cuddle? You know, if you've ever had a baby, you know that that feeling of holding a baby.
And it looks so real. When I was growing up, they were kind of real looking, but not quite like this.
Yeah.
This is, there's soft material up here, and it's rubbery down here, just like a baby would hold its little finger. And now, the students get these from where?
So we ask for donations. We have donation boxes in the school, and we actually had one student who went out and collected 10 dolls that she brought in. Most of them were new, but we'll accept gently used dolls also.
If somebody wanted to buy one of this and donate it, where would they go?
Well, they could certainly bring it to Assebet, or they could go to their local long-term care facility and see if there was anyone there who would enjoy a doll.
Oh, wow.
You know, so
how many do you
it's
bring with
local.
you when you go, though, Kathy? How many do you bring?
So when we go, we dropped off about 10, and I have about 10 more I'm going to drop off. And then this doll would stay with one person, and this would be their doll. So we would leave the doll, and if the person wanted to enjoy the doll, holding the doll, they would just, pick the doll up.
They can keep it.
Yep, and they would have it. But I wouldn't, give someone the baby, because if you don't want to babysit, that's stressful.
Yeah.
But just picking the doll up, holding the doll.
Just going in and
Feeling
saying, would
the
you
love.
like to hold this? And then see the reaction?
Sometimes I do that, but sometimes I'll just put the doll next to them.
Yeah.
So one way that it works is if somebody is feeling very anxious.
Yeah.
And people who have Alzheimer's disease have a really hard time expressing themselves. So often they'll express how they're feeling through behavior. So they may act out, or they may do things that we wouldn't really expect them to do. And that is behavior. That's just, they're trying to communicate with you.
Sure.
So sometimes I'll put a doll near them,
Yeah.
and that might be enough of a distraction that they will stop the behavior that they're doing, feel less anxious,
Yeah.
and then enjoy the doll. So as I said, there's been research that has shown that for many people, doll therapy is a great, effective way to decrease anxiety.
What about for children, just off the cuff here? Children like in Children's Medical Center and things like this, aren't they start doing things like this for them too? Or?
So I'm sure that they have lots of dolls like this for the little children. It's a different type of therapy, though, when we're talking about an adult, an
Right.
older adult who has dementia.
Sure.
So if someone didn't have dementia, they may still enjoy holding the doll, but it's not as much of a therapy for them as for someone with dementia, because it's very calming and it's very decreases their anxiety.
Kathy Faddoul, she is an RN and she's a teacher over at Assebet Valley Regional High School. And students learn, they're specializing, and one of the things is dementia.
Yes.
And how often do you take the students over to the facility?
So we'll go twice a week.
Wow.
Yeah.
That's a lot.
On our schedule, we see our junior students about every other week during the school year.
Juniors, juniors, the
So-
junior class, okay.
So they need to be 16 to interact and to work with residents.
Yeah.
So we'll go over twice a week for probably about 10 weeks during the year. It's great, and the students really enjoy working with the adults, with the older adults.
When did you start this, Kathy?
Let's see. So I've been at Assebet about 6 or 7 years now.
Yeah.
We have worked a lot with dementia over probably the past 4 or 5 years. So the Dolls for Dementia, I think this is the 3rd or 4th year that we've been collecting dolls to bring to Coleman House. But we also have a program where we, my junior students learn about dementia, and they then go to different programs in our school, for instance, plumbing, and they'll talk to the future plumbers about working with people with dementia.
Wow,
So-
that's quite a step, huh?
It is. It's really exciting.
Yeah. Who would think? It wouldn't even occur to me.
Yeah.
Yeah.
So when we go, my students teach their peers. They teach them communication strategies, how to recognize if someone is, we're not asking them to diagnose anyone with dementia, but just to recognize that someone is responding a little bit differently than they would expect.
Yeah.
Take a step back, react with kindness, and maybe use some of the strategies that we give them, like, wear a name tag, explain what you're doing, ways that you can, what if you're working with someone you're going to someone's home who has dementia and they try to take your tools, or they're asking you a lot of questions and you're trying to get your job done. So we just give them some strategies on how to work with people who are living with dementia.
Is this, being an RN, is this what you chose to specialize in?
Actually not, no.
Okay.
Not at all. And I didn't really even know much about dementia until I started teaching at Assebet. And we teach our students a curriculum from the Alzheimer's Association on person-centered caring for people with dementia curriculum.
Yeah.
And that really got me interested in it. And I have a family member with Alzheimer's disease, and I saw...
Does he or she have a doll?
No, she doesn't. But she does have a little stuffed animal. And I also saw how it affected everyone else around her.
Yeah.
Her caregivers. So, you know, it's one of those things that until it hits you, you really don't understand it. You don't understand how devastating it is.
And years ago, even just a few years ago, who would have thought that donating dolls, beautiful, I mean baby dolls, would help patients in the Alzheimer's war part of the hospital, or whatever, to help them feel connected, right? And that they're also, I don't know, you're taking care of someone.
Yes.
Because it diverts, as you said, it's a distraction. It diverts them away from, oh no, what's going to happen, to, oh, I have to take care of my doll. We talking with Kathy Faddoul, and she brought me some. All right, did you name these?
No names.
All right, sit here. So now, it's the impact of Alzheimer's on the workplace. Now, this is, I don't know, Paul, if you could zero in on this, but from the Alzheimer's Association, it talks about how to deal with that.
Right, so most of the people that have Alzheimer's are living at home. So you would think that many people who have Alzheimer's disease or other dementias are living in long-term care facilities, but most of them are actually living at home and coming into your local bank or going to your restaurant or trying to shop at your grocery store.
Yeah.
So for people in the workforce, you're either going to be working with someone who's caring for someone with dementia, or you're going to be waiting on someone or servicing someone who has dementia.
A lot of us don't even think about it. You know, it's fun. This is not funny. Picture on one of their flyers of a senior lady, and it says, "Yesterday I saw my daughter, and I couldn't remember her name." Luckily I never ran into that in my family, but it's got to be devastating for the person visiting.
Yes.
But would you say maybe they don't remember your name, but do they know who you are? That's what drive me nuts if they didn't know who I was.
So sometimes, I think the thing about Alzheimer's disease is that it's a brain disease. It's a deterioration of the brain. When a person, it's a terminal disease. There is no cure. When someone dies from Alzheimer's disease, their brain weighs about 1/3 of what a brain would weigh of someone who did not have Alzheimer's disease. And the behaviors can seem very intentional when they're not. They're a way to express themselves or communicate, and it's based on what's happening in the brain. So, you know, it's everywhere. It's a devastating disease for family, and everybody reacts and responds differently to it. There's not a set course. Many people have Alzheimer's disease for many years before they're diagnosed. And they say that the life expectancy is probably 8 to 10 years after diagnosis. But honestly, I've seen people live a lot longer.
Yeah.
And it doesn't get better.
No, it doesn't. No. It just blows the mind. This is the Kathy Faddoul again. She's from the Assebet Valley Regional High School over in Marlboro. And she's an RN and she's a teacher. And she teaches health technology, right?
Yes.
And you're wondering again while we're sitting here, if you just tuned in, why are they there with dolls? Because it's a students learn by doing, and the students who are studying about Alzheimer's disease, right, can bring in, twice a week they go over and donate dolls like this for patients with Alzheimer's. It gives them a sense of security. Would you say it's almost like they're going back to their childhood?
It could be. It could be anything. You know, everyone is different. Everyone responds differently. And for some people, they don't want the dolls. But for some other people, you know, if I am there and I see someone who has the baby, I'll thank them. Thank you for watching the baby today. It gives them a sense of purpose. It gives them a sense of meaning. And that positive emotion that you get from a child.
Yeah.
You know, that stays with them. The emotion is really strong and it stays with them.
Is there a little I used to feed the baby dolls. Is there a hole to feed? Well, you can put a little
Yeah,
bottle
you
in
can
the
put a little
mouth.
bottle. And we don't really want a doll that makes noise or anything like that because
Yeah.
we don't want to have to, have a crying baby.
Yeah.
We just want a nice baby who's going to enjoy us, and we will enjoy the baby.
I'm looking at the back to see. Okay. Now, if somebody wanted to donate, Kathy, how would they reach you?
So, I can be reached at Assebet Valley Regional Technical High School in Marlborough, Mass. My email is kfaddoul@assebet.org. Or you can just pick up a doll and bring it to your local nursing home because they would love it.
Yeah, now also something I hadn't known here about this. They have a 24/7 helpline
Through the Alzheimer's Association.
for the Alzheimer's Association. 800-272-3900. 800-272-3900. 24 hours a day, 7 days a week. Confidential. Experienced counselors are on that phone. Do you do that too?
So I do not,
Yeah.
but all of the counselors that are master's level or higher,
Yeah.
and it's open for anybody and it's free. And if you, it's 3 a.m. and you are a nurse working and you have a question about Alzheimer's, you can call. If you are a family member, call. If you are just don't know what to do next,
Yeah.
they can set up a care consult so that they can help you to try to figure things out.
Yeah. That's
The services they have through the Alzheimer's Association are amazing. ALZ.org is their website,
ALZ.org.
and they also have the Walk to End Alzheimer's Disease.
When is that now?
So the Worcester County one is September 15th.
September 15th.
Yeah, we do have, Assebet has a team that goes there every year. We volunteer. We help out before the walk. We help out. I'm actually the team captain. I'm so proud of it.
That's good.
Yep, I bring my students with me.
I can actually picture everybody with a backpack or a thing like this with a doll in it.
Yeah.
People say, "Why are you doing that?" And then it comes right to the program you're doing.
Oh, yes, that's great. I love that.
Yeah, the little here, or somebody could wear in the backpack, and it really brings attention to why is the people. We'll tell you why.
Yes, yes.
That's a really cool.
I like
thing.
that.
Yeah, I think. Well, it makes sense.
Mm-hmm.
Now, do the hospitals around here, are they familiar with this, with what you're doing? The hospitals, because they do have sections, some of them, for Alzheimer's patients.
So, doll therapy is it is in the literature. It is, people are using it. When people are in the hospital, especially someone who has dementia or Alzheimer's disease, it's really difficult for them. They're out of their environment. They have no control over anything, and they're sick. So, doll therapy would probably be a great thing for them.
Yeah. Now, if somebody, I was going to say, it also on the 24/7 hotline links to programs and services, ongoing guidance. Do you go into someone's home if somebody calls you or whatever, gets in touch with you? Look, my aunt has Alzheimer's, and this doll program looks pretty good to me, and I bet she'd love it. Would you go? Would you go with a student?
So we are not allowed to bring our students into people's homes.
Okay.
But the dolls work out for everybody.
And you would go?
So our students, when they go into the long-term care facility, they provide all the care. They don't just bring the dolls; they just provide all the care that they can for the patients,
They sit
for
right
the residents
down
there.
They sit with them and everything?
Yes, yes, and I think that's the best part.
Yeah.
Many of our students, don't work a lot or have a lot of older people that they communicate with and are trying to have conversations with. And we bring them into the long-term care facility, and it's like they're making the best friends. They're learning so much about each other.
Yeah.
They learn from our older adults who have so much to give.
Yeah.
And the older adults enjoy having the students come in and talk to them.
Oh, definitely. I mean, God, I forbid, I don't even want to look ahead like that. I mean, it's scary to most of us, you know. But I would think that I would still be so much in touch with,
the babies.
Not a problem, give me the doll. I think I've always been, for many years, a proponent of when people, adults too, go into surgery, pre-op. You know how they provide those little slippers for you and your Johnny, and they're all folded on the stretcher, right? Like, I know what this is. Yeah. So we end up sometimes taking them home. But if hospitals could afford, it can't be that expensive. Not a big fat teddy bear, but something. They know a male patient is coming in. It's sitting right there. Something to hang on. Because I think adults are just big kids. I don't think kids are little adults. I do think that I really do. I think that it's really, there's so many people who are afraid. And I can see where the Alzheimer's patients, the fear, that hadn't occurred to me. when you're talking about the fear that they have, to me it would be more, I would thought, well, they're frustrated, but the fear that now they have, at what point does that kick in with the disease?
So everybody's different, but really pretty soon. I mean, to know that you have a terminal illness is frightening. And to know that there's no cure and that you're only going to get worse and that you may forget the people that you love the most and the memories that you cherish the most is devastating. So as people progress through the disease, now their fears change.
Yeah.
So they forget that they have Alzheimer's disease, but now they're not sure what's coming next. They don't have control over their day.
Do they know it's terminal?
At the beginning, yes.
I think I've seen in the obituaries, not much, not long, but once in a while I might, once in a blue moon, find somebody late 50s. I'm like, wow. Because isn't it plaque build up in the head, in the brain?
So that's what they're thinking, yes, that it's plaque that builds up, amyloid plaque and beta tangles, so, or the tau tangles, but plaques and tangles build up in your brain. They think that actually starts about 20 years, 10 to 20 years before you have symptoms. Yes, and you can have early onset disease or younger age onset disease, which is usually someone younger than 65.
Yeah.
Although most people that have Alzheimer's disease are over 65. And all of the research, nothing has shown that, we have a cure in sight.
Yeah.
They're looking at things that, are quality of life things that help your heart are going to help your head. So eating healthy, sleeping, not smoking, having exercise, not being lonely. Isolation is something that
See
is
a lot about
huge.
that nowadays.
Yeah, really
Isolation.
big.
You think, well, I've seen seniors get together, someone will say to me, over at the senior center, so they're not isolating. I'm like, how do you know?
Yeah, what happens after that when people are home alone?
Is their family calling them? Are they visiting them? You can still know, like, a senior center's there and it's wonderful. Like, I'm all for it. But then when you leave, maybe your friends aren't coming to visit you. They only see you maybe once a week over there. I don't know. It baffles the mind. How do the students, we're talking again with Kathy Faddoul, and she's in charge of a program at Assebet Valley Regional High School, got it, in Marlborough. And what it does is it teaches the students, how to interact with patients with Alzheimer's. And when I read this article, I'm like, this is fantastic. They provide these dolls. If the person would like to have one, it gives them something to hang on to and love and focus on. I think the focus part, because people, can you tell me about the baby and this and that? I think it's pretty cool. Not just the ladies, it's for guys too.
It is.
She's holding a boy doll, Is it hard, Kathy, for you to deal with, which is harder, with the family and the friends and members who are going through this along with the patient, or do you think it's harder for the patient?
Oh, that's hard because, it's difficult to say.
Yeah.
Because the person who has dementia is on their own journey, but they forget that they have dementia. They forget that they have an illness. And the people that are around them, they are day by day losing their loved one and just watching them slip away.
Yeah.
It's a horrible, horrible disease that's devastating for everybody.
And there are isn't Assebet one of the medicines that's out now?
There are a lot of medicines that are out. They're trying to get new ones. Nothing has been shown to stop the progression. It may slow it a little bit, but nothing has been shown to stop it or reverse it that I'm aware of.
Is it hereditary?
There is a small piece that's hereditary.
Yeah.
There is a gene that is responsible for a small percentage.
Yeah.
But most of it is,
Just life. I know some people nowadays, I think it might be pretty costly, but are getting, is there a blood test or something you can take to find out what might be ahead of you?
So you could probably have some genetic testing done to see
I'm not
if
so
you
sure I
have
want to know.
I know, right?
What am I going to do? Now I'm going to dread it if I find this out.
Right.
What the heck,
Right.
Maybe for some people it's not the best idea.
Well, you could do some planning if you have a lot of it in your family. And
But it might not happen, though. And here
Right.
you are planning, and you go on for 50 more years, Again, we're talking with Kathy Faddoul. Kathy, how can they get a hold of you?
So, you can reach me at Assebet Valley Regional High School in Marlborough, Mass. My email is kfaddoul@assebet.org. or like I said, you can just drop off a doll at a local nursing home. They
Sure.
would love
Now,
it.
does it have to be this kind of a doll?
Well, no, we have other dolls too, but a baby doll is
Okay.
good, and not a doll that cries or makes noise.
Okay.
Not like a Barbie doll or something like that, but
No.
something that someone could hold.
Yeah, not
You
the
know,
kind
I
that you
have some-
press on the hand and it goes wah.
Right,
No.
exactly. We don't want that.
No.
And I do have some that are smaller. Some, this size are smaller.
I like this size.
Yeah.
It's pretty cool.
Yep. So.
Now, wonderful brochure. In fact, Kathy's going to leave some things on the bulletin board downstairs at the Upton Library for you folks to go drop by and feel free to take one. Know the 10 signs.
Mhm.
We've got about 5 minutes left. Do you know? Can you tell us about it?
So, the things to look for: memory loss that affects your daily life. So, memory loss that affects your daily life is not a part of normal aging. Normal aging is forgetting where your keys are,
Yeah.
right?
Right here. Yeah.
But being able to retrace your steps and go back and find your keys.
Yeah.
So, not being able to retrace your steps, not remembering your daughter's name, not remembering things that are going to affect your daily life.
Right.
So that's one.
That's one.
So a decrease in judgment.
Yeah.
So the telemarketer calls, or someone who's calling on the phone saying, "Oh, we need your money."
Scam call.
The scam calls. Yep. So that is one reason why they kind of call the older people, because a lot of people with Alzheimer's disease are living at home.
Difficulty completing. Now I've seen this with an acquaintance. Difficulty completing familiar tasks.
Mhm.
Now it says at home or at work or at leisure.
Yes.
Yeah.
So many of the people that are diagnosed with the younger onset Alzheimer's are working. And that's one of the things that they find. They're getting fired from their jobs, or they're being spoken to at work because this job that they've been able to do forever,
Yeah.
now they can't do it.
Confusion with time or place.
So that could be that you don't know what day it is, or you don't know how to get home from a familiar place. So, I often don't know what day it is,
Yeah.
but if I'm at a store, I know how to get home.
Yeah. Sure.
But you could be in a very familiar place and say, do I go left or right here?
Someone I know, many years ago, he was driving along a highway, and suddenly, he might have been in his 50s, I don't know, I guess from what I heard, didn't know where he was.
Mm-hmm.
So I guess he called a friend to come be with him or come get him or something, but that's awfully young. But I don't know if anything happening to him after that, but is that something, or is that just a psychotic break? Not just, but a psychotic break of some kind.
So it's usually something that happens more than once.
Okay.
So this is something that's going to probably come on gradually.
Yeah.
People are going to kind of notice, and then notice a lot.
Trouble understanding visual images and spatial relationships.
Yes. So Alzheimer's disease affects your brain not only in the way that you think, but also it affects your vision, and it affects your depth perception.
Yeah.
So driving can be very difficult, and that is a challenge for many people when their parents or their loved ones should no longer be driving. Taking that car away, taking the keys away is hard.
That's a kicker, I think, for anybody. I mean, even with the Alzheimer's, but even someone who doesn't have it, suddenly they have to give up the car. They're driving. Oh, yeah.
It's really
Misplacing
really
things and losing the ability to retrace your steps, which you just mentioned. Decreased or poor judgment. Could be about anything, right?
It could be anything. It could be giving someone your bank account number.
Oh.
It could be, driving into traffic the wrong way. It could be not dressing appropriately for the weather.
Withdrawal from work or social activities.
And you'll see that because now people can't remember people's names, or can't follow a conversation, or forget how to play bridge or whatever the game is that they're playing.
Yeah.
So they just stop going.
And last but not least, changes in mood and personality. Now, it affects the mood because is it frustration? Anger?
It's brain changes. So it's brain changes.
Yeah.
So that people cannot respond as quickly, and it's just the way that your brain is deteriorating.
Kathy, thank you for being with us.
Thank you
Kathy
for having
Faddoul,
me.
she's an RN and teacher at Assebet Valley Regional High School in Marlborough. She's in charge of the Students Learn by Doing, and they deal with Alzheimer's patients. They go in and, if you'd like that the patient looks like they might like to have a doll, guys and gals, it gives them something to hang on to that is a definite every day, right? what if they choose to name the doll? Will they remember? What are the odds they're going to remember the name?
They probably won't. But
Maybe just baby.
yeah, or the name might change every day, and it doesn't even matter. And I wouldn't even ask them their name. I would just say, "I love your baby, and you are such a good mom," or whatever it is, and be positive, and just the emotions and the feelings and the kindness and the love.
And if you'd like to donate some dolls, doesn't have to be this particular brand, but a baby doll is best that does not cry. How do they get in touch with you again?
So it's kfaddoul@assebet.org, or I am at Assebet Valley Regional Technical High School in Marlborough, Mass., or just drop off a doll at a local long-term care facility.
I think this is awesome.
Thank you.
Thank you so much.
Thank you so much for having me.
You're welcome. We'll see you next time and be my guest.
Riding on a shooting star, heading out toward a dream.